How did cystic fibrosis airway clearance devices evolve? Imagine a time when clearing mucus from the lungs meant manual pounding on the chest or awkward positions that only a caregiver could do. That was the reality for many with cystic fibrosis before modern devices changed the game. In the early days, airway clearance relied heavily on manual techniques like chest physiotherapy, which included percussion and postural drainage. Postural drainage, developed in the 1970s, used gravity to help drain mucus by positioning patients upside down or at angles, but it was often uncomfortable and required a lot of effort. Manual chest physiotherapy involved caregivers rhythmically clapping on the chest to loosen mucus, but it was physically demanding and time-consuming for everyone involved. Back then, adjunct therapies like mist tents were used to humidify air and help thin mucus, but these were phased out due to infection risks. Overall, these methods worked but had limitations in independence and convenience, especially for long-term management at home. The real turning point came in the mid-1980s when engineers and researchers started developing mechanical devices to assist with mucus clearance. The first major breakthrough was the high-frequency chest wall oscillation device, created in 1985 by researchers at the University of Minnesota. This device used an inflatable vest connected to an air pulse generator that delivered rapid chest compressions, helping to loosen and move mucus more effectively. It was called the THAI-RAPI vest and later became known as the Vest Airway Clearance System. Over time, this device was improved to be smaller, quieter, and more portable, making it easier for patients to use at home and increasing independence. Alongside the vest, other oscillating devices appeared, such as positive expiratory pressure devices and oscillatory PEP devices like the Flutter and Acapella. These devices work by creating pressure and vibrations during exhalation, which helps to loosen mucus from the airway walls. They became especially popular in countries like Canada, where cost constraints made high-tech devices less accessible. Another technique that has been around since the 1960s is autogenic drainage, developed in Belgium. It involves controlled breathing to mobilize mucus without any device, making it a useful option for some patients. By the early 2000s, airway clearance devices had become a key part of cystic fibrosis treatment plans. Medical guidelines now recommend tailoring therapy to each person's needs and preferences, often combining mechanical devices with exercise to boost overall lung health. Exercise helps improve lung capacity and can make mucus clearance easier. Today, the evolution of these devices reflects a shift toward more patient-friendly, effective, and independent options. The development of the high-frequency chest, while oscillation vest and oscillating PEP devices marked major milestones, supported by extensive research and clinical use. These innovations have truly transformed airway clearance from a labor-intensive chore into a manageable, effective part of cystic fibrosis care, helping people breathe easier and live better. Always remember, it's important to work with healthcare professionals to find the best approach for individual needs.